1. What is the meaning of drab? A. Danger, review, airway, breathing. B. Danger, response, airway, breathing. C. Danger, review, airway, bleeding. D. Danger, response, airway, bleeding. Two of these, which is not a first aid goal? A. Preserve life. B. Prevent worsening of the condition. C. Protect wounds. D. Promote recovery. Three. You get to the scene of an automobile collision. Many of the casualties have severe injuries. To whom should you offer aid first? A. The victim in the most pain. B. The youngest victim. C. The victim who isn't making any noise. D. The victim who is bleeding. Four. Who is the most important person in an emergency? A. The injured victim. B. Yourself. C. EMS. D. Bystanders. Five. What does first aid shock mean? A. Lack of oxygen reaching the body's cells and tissues. B. Low blood sugar levels. C. The body temperature drops too low. D. A state of emotional distress. Six. What is the best method for halting significant bleeding? A. Irrigation with water. B. Indirect pressure. C. Direct pressure. D. Elevation. Seven. When should you drive to the hospital emergency room instead of calling an ambulance? A. The injury or condition could become life-threatening on the way to the hospital. B. The injury or condition is life-threatening on the way to the hospital. C. The route to the hospital is long or congested. D. All of the above. Eight. Listing crucial phone numbers on a notepad close at hand is one approach to be ready for anything. Which of these figures ought to be on the list? A. Neighbor. B. Poison Control Center. C. Family doctor. D. All of the above. Nine. In a hospital emergency room, which healthcare expert or professionals are most likely to be present? A. Emergency doctor. B. Emergency nurse. C. Paramedic. D. All of the above. Ten. Which of these oughts to be in your first aid kit at home? A. Aspirin. B. Hydrogen peroxide. C. Calamine lotion. D. All of the above. (11) What should you tell the dispatcher if you have an emergency and need to contact 911? A. Give your name and the telephone number of the phone you are using to make the call. B. Describe the emergency. C. Give the exact address where the emergency occurred. D. All of the above. (12) How often should a non-medical person attend a CPR refresher course? A. every 3 years. B. Every 2 years. C. Every year. D. Every 5 years. "13. What should you do if someone has a wound that is bleeding? A. Cover the wound with a clean cloth and use continuous pressure with the palm of your hand. B. Apply a tourniquet right away. C. Both cover the wound with a clean cloth and use continuous pressure with the palm of your hand and raise the wound above the victim's heart to slow the bleeding. D. Raise the wound above the victim's heart to slow the bleeding. "14. Which of these is an allergic response symptom? A. Abdominal pain, nausea, or vomiting. B. Difficulty in breathing. C. Tightness in the throat, swollen lips, tongue. D. All of the above. "15. What breathing, circulatory, and airway techniques are appropriate for performing CPR? A. Back, circulation, airway. B. Chest compressions, airway, breathing. C. Airway, breastbone, chest. D. Airway, breathing, circulation. "16. Which of the following describes a heart attack's most typical symptoms? A. Cough. B. Nausea. C. Shortness of breath. D. Chest pain. "17. What kind of first assistance is appropriate for a person experiencing a heart attack? A. Perform CPR. B. Call 911 or your local emergency number. C. Loosen his/her clothing. D. All of the above. "18. When tending to wound and scrapes, which of the following actions should you avoid? A. Cover the wound. B. Apply pressure on the wound with a clean cloth or bandage. C. Wash the wound with soap. D. Apply an antibiotic to the wound. "19. When taking a severed finger, or part of one, to the emergency room, how should you carry it? A. You should not carry it but dispose of it in seal-proof bag. B. Put the severed part directly in water. C. Use dry ice to freeze severed part. D. Place it in a clean plastic bag, pack the bag in ice. "20. When providing heat stroke victims with first aid, you should never: A. Give them alcoholic fluids to drink. B. Place ice on their head, neck, armpits, and groin. C. Remove their outer clothing. D. Take them to a cool, shady area. First aid training. Imagine a world where every individual possesses the ability to spring into action during emergency situations, armed with the knowledge and confidence to provide life-saving assistance. This is the vision that underpins the importance of first aid training, a skill set that can truly make the difference between life and death. First aid is not just about applying bandages or administering CPR, it represents a powerful tool for community empowerment and disaster preparedness. First aid kits are essential tools for handling minor injuries and medical emergencies. Many people overlook the importance of having a well-stocked and up-to-date first aid kit, but it can make a crucial difference in potentially life-threatening situations. Beyond the basic bandages and antiseptic wipes, there are several items that could be included to enhance the effectiveness of a first aid kit, such as tweezers for removing splinters or ticks, instant cold packs for reducing swelling, and CPR masks for performing rescue breaths.